Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
The lumbar spine, or the low back, is a structure of interconnecting bones, joints, nerves, ligaments. It's really pretty complex. The lower back supports the weight of the upper body, and it provides flexibility for motions like bending and twisting.
Two of my favorite things, bending and twisting. Yeah. All of those moving parts, though, can also mean trouble. Almost anyone who experiences low back pain at one time or another might agree with that. It's often, and it's one of the most common causes of disability in America. Luckily, you can take measures to treat and even prevent low back pain. Here to discuss is physical medicine and rehabilitation specialist, Dr. Ralph Gay. Welcome to the program, Dr. Gay. It's nice to meet you.
Thank you. Glad to be here.
Dr. Gay, good to have you on the program. So it's interesting, isn't it, that this is so common? 8 out of 10 people will have back pain at some point during their lives. It's the leading cause of disability for men over the age of 45. What is the problem with the low back?
The problem is that we're all aging. That's part of it. But low back pain concerns people of almost all ages. We see significant low back pain in adolescents and young people. The most common age group for disc herniation is between the ages of 30 and 50. We're seeing a lot more people who are living longer and trying to be active. So many more people who have spinal stenosis.
Tell us what that means, stenosis.
Okay. It's spinal stenosis. Stenosis means narrowing. And you can have stenosis of many structures in your body, stenosis of your arteries that go to your heart. Stenosis of the spine has to do with the canal that the nerves go through. And there's a main canal that goes down through the middle, then there's two small at each level between the vertebra. There are two small canals called foramen, and they can become narrow or stenosed as well. The common spinal stenosis is stenosis of the main canal that can cause pain when you stand and walk because that canal gets smaller at that time, and you get pain in your buttocks or legs typically, and you sit down and it goes away. So that's a common cause of buttock and leg pain, and sometimes back pain as well in more elderly patients. And then we all are aging, and our spine ages. Our spine starts aging on a microscopic level by our late teen years. By the time we hit our 20s, we start seeing disc bulges and protruding discs. And it just gradually ages as we get older. We don't know exactly why. This is not something where it's a bad gene. We do know that a lot of it is genetically determined based on twin studies where we can look at people who have identical DNA. This is primarily done in Northern European countries like Denmark, where they can track people throughout their life. But a lot of this is genetically determined, and we're living longer, and we're wanting to be more active. And so we see back pain throughout the course of life.
So is this a skeletal problem because of that stenosis of the spine, or is it a muscle? I always just think my low back pain is a muscle problem, but it doesn't sound like it is.
Well, that's a very good question, and it's one that we don't have a very clear answer to. When you look at studies that try to isolate what is causing back pain as far as a specific tissue, is it a joint, is it a muscle, is it a nerve, we can't do that very well. And some of the studies would suggest that no more than maybe 10 to 15% of the time can we isolate a structure that we know is causing the person's pain. Most often it's multifactorial. If you have an arthritic joint in your back and it's aggravated, the muscles get tight and they become painful. We're very good at finding nerve problems, pinched nerves or injured nerves, but when we get out of the realm of the nerve tissue into the musculoskeletal tissue, as we say, the bones and the joints and the discs, we're not very good at isolating exactly where the pain is coming from, and it's very difficult to do that clinically. There are a few of the tissues that we can within reason say are causing pain, such as the small joints in the low back that often are affected by arthritis. But there are other structures that we know cause pain, such as the disc. And we have no way of going in and numbing it up and proving that that's where the pain is coming from. It's all on clinical impression.
If you get back pain after a weekend of heavy lifting or a lot of golf or whatever, and it's not bad enough or hasn't lasted long enough for you to think that you ought to go see the physician, what's the best thing to do for it?
The common recommendation, or the current recommendation, is that we don't go see a doctor right away, as you've insinuated. The best thing to do is rest, possibly take some ibuprofen or Tylenol, and you can use ice or heat. There's no science to tell us which works better.
Yeah, that was a question we all want to ask. What do I use, ice or heat? And there's no right answer, huh?
No, we depend on extrapolating from joint problems or joint injuries, such as sprained ankles, where we theoretically believe that we believe that if we put ice on it, it reduces inflammation from an injury. Well, that's not necessarily going to help in the low back, because the cold from the ice doesn't get deep enough to affect the physiology down around the spine. And the same way with heat. The heat doesn't get down there far enough. And so it's probably affecting the nerves and the muscles that it can penetrate more than anything else, and affecting the pain that way. Certainly ice or heat can reduce some pain, and it can help with muscle spasm if you're having spasm. But I can't tell you that there's a right and a wrong application of ice and heat in that situation. If it's acute, I would go with the ice first. I'd try it first.
And when you say rest, what do you mean by rest? You don't mean lay down in bed?
No, rest is relative rest. And we know that if you lay in bed for 3 days, it's going to be more damaging than helpful. When we lay down, we lose muscle mass, we lose bone density, and it doesn't take very long not being active before those things can become measurable. So rest is reducing your activities to the point that you're not making yourself miserable, is the way I explain it to my patients. It's not likely you're going to do additional damage unless you have like pain, numbness, and tingling down your leg, where you probably have a pinched nerve. If it's back pain, I would do whatever I can reasonably do without making myself miserable. And I would expect things to get better over a course of a week or maybe 2 weeks sometimes.
And some treatment might be my favorite, massage. But what else?
Well, there is evidence for many types of treatment for back pain. None of the evidence is strong. Whether it be the anti-inflammatory medicines or spinal manipulations, such as a chiropractor or physical therapist might provide, or massage, or acupuncture, or Tai Chi, or yoga. There's some evidence for most of these things, but the evidence is not strong for any of it. And that's why we have so many different treatments that people get to choose from. One of my friends, Scott Haldeman, wrote an article a few years ago, and they described it like going through the back pain supermarket. You can just pick things off the shelves that you wanted to try. And that's because none of them work wonderfully, I should say. So as far as what is best, in your case, I would say what's worked in the past.
Sure.
What do you tolerate? What are you willing to do? But not only can you do those passive things, you have to do some active things. You have to keep moving with relative rest.
All right. And how about prevention? A few hints about that. And then we don't have to worry about all those options.
Yeah, that would be wonderful if we could prevent all this from occurring to begin with. Again, we don't have good studies that tell us that we can prevent back pain. We know that we can prevent episodes of back pain at times, and the only thing that has strong evidence there is exercise. None of the rest of the treatments that we do can really prevent pain. And there are certain factors, though, risk factors, that we can alter. If you smoke, stop smoking, because smoking, the nicotine affects the blood supply to the disc, the outside of the disc, and the small pores that go in and out of the disc from the bone, and it can increase disc degeneration. If you're overweight, if you lose weight, it's probably going to help. If you don't exercise, that's a risk factor. Being sedentary is a risk factor, and we're more sedentary now in our society than we've probably ever been in the past, and that's probably one of the reasons that there's so many people who suffer from back pain.
Yeah, obesity a problem. Well, just imagine strapping a 15 or 20 pound weight around your abdomen and how much your back would hurt at the end of the day. Yeah.
How many of us are 30 pounds overweight?
Yeah.
Carry a 30-pound backpack around and see what the difference makes. If it occurs to us slow, we don't think of it over time. But if it occurs quickly, then you become very aware that this is a stress that my back doesn't need.
Right. Well, a common problem, low back pain. Unfortunately, we don't have all the answers, but there are some things that you can do to prevent it. Dr. Ralph Gay, physiatrist, physical medicine and rehabilitation specialist is another name for that. Thanks so much for being with us.
You're very welcome.